Good evening and welcome to Sabha TV. I'm Tina Jha with News Tonight, where we get you the day's biggest news stories from across India and around the world. India on Saturday recorded the third straight day of highest spike in the number of COVID-19 infections. Nearly 25,000 cases have been reported in the last 4 days after restrictions were eased in most parts of the country as the fourth phase of the lockdown began. For now, India is 11th on the list of affected countries in terms of the number of infections.
According to the Health Ministry, 6,654 new cases were reported yesterday, taking the total confirmed cases to over 1.25 lakh. Of the total confirmed cases, there are 69,597 active cases. 137 patients succumbed to the viral infection on Friday. The death toll now stands at 3,720. Over 51,000 patients have been cured of the disease, taking the recovery rate to 41.29%. India is witnessing a significant increase in COVID-19 cases in the month of May. Around 74% of India's total cases have been reported this month. From an average of 3,829 cases in the 6 days from 10th May to the 15th, the number has risen to 5,407 in the last 6 days from 16th May to 21st. The number of reported coronavirus cases in India rose 11% over the past 2 days. Experts attribute the increase in cases to easing of lockdown restrictions and migrant movement. Another factor is the increase in testing samples. India has significantly ramped up COVID-19 testing since the first test was conducted on 24th of January. In the past 2 months alone, India's testing capacity has increased by 100 times. As of Saturday, the total number of samples tested for the novel coronavirus across the country stands at 28,34,798. This includes over 1.15 lakh samples tested for COVID-19 in the past 24 hours. But despite a seemingly high number of cases, the growth in the number of new infections has been linear and not exponential. India's record of low deaths is also a matter of great relief. At 2.9%, India's death rate is less than half of the global death rate and that of the United States, which is the worst affected country. So how has India been able to control the mortality rate and the growth rate? The reasons for this could be one or a combination of factors like immunity of the young population, BCG vaccine for tuberculosis, the hot temperature, and a milder strain of the virus. But among these, India's stringent lockdown since March is one of the most definite factors. Lockdowns 1 and 2 managed to avert between 14 and 29 lakh coronavirus cases and 54,000 deaths, according to government data released on Friday. A recent study by the Boston Consulting Group, in which they adopted 2 approaches for projections, estimated 36 lakh to 70 lakh cases averted and 1.2 lakh to 2.1 lakh lives saved as a direct consequence of the lockdown. Another estimate by the Public Health Foundation of India states that 78,000 deaths have been averted.
95% confidence level पे ये पाया गया कि most of the deaths that could have been averted, the cases that could have been averted are well within a reasonable estimate of different models by independent researchers. So we have full confidence कि जो modeling की गई है, it would have shown you कि lockdown अगर नहीं होता तो कितने cases और होते. So this is the confidence that we have that the lockdown with the full cooperation of the public has paid rich dividends.
In the press briefing on Friday, V.K. Paul, chairman of the Empowered Group 1 formed for COVID-19 management, said the timely nationwide lockdown achieved its purpose of containing the virus and in helping the country ramp up its health infrastructure. Paul, however, added that the lockdown could not be continued for an unlimited time and urged people to create headwinds needed to ensure that the virus does not grow.
Ultimately तो दवाई होगी, वैक्सीन होगा, वो कवच हमारे पास नहीं है, लेकिन हम वायरस को आगे जो उसकी पुश है उसको उल्टी तरफ रोकने के लिए जो हम अपने सोशल डिस्टेंसिंग के स्टेप लेंगे उसमें हम कोई भी ढील नहीं दे सकते. 2 गज की दूरी, हैंड हाइजीन, self-protection with Ayush and good nutrition, care of the elderly, early care seeking and आरोग्य सेतु. डरने से छुपाने से नहीं ठीक होगा और दूसरे को स्टिग्मेटाइज करना तो अनएथिकल है, इमोरल है.
A study based on a mathematical model approved by the Government Science and Engineering Research Board predicts India may witness COVID-19 cases peaking between 21st to 28th of June, with maximum daily positive cases to be around 7,000 to 7,500 in this period. According to the study, confirmed COVID-19 cases reported daily will show a rising graph till the end of June. A clear downward trend in the confirmed cases is likely to be observed each day from the second week of July. With measures in place and increased testing, a gradual flattening of the trajectory is expected within October. Bureau Report, Rajya TV.
On the 60th day of the national lockdown, Maharashtra has the highest incidence of coronavirus infections, nearly 1/3 of the national total. Gujarat, Tamil Nadu, Delhi are the other three states where the number of coronavirus cases is rapidly rising.
Gujarat, Tamil Nadu and Delhi are the three other states where novel coronavirus cases are rapidly rising. COVID-19 cases in Maharashtra crossed 44,000 on Saturday. COVID-19 deaths total 1,517 in the state, the highest in the country. Over 12,000 patients have recovered. Mumbai alone has over 27,000 novel coronavirus cases. Cities like Pune and Nashik are the other hotspots in Maharashtra. According to data from the Maharashtra Health Department, in the past month, Maharashtra's COVID-19 mortality rate has fallen from 4.76% to 3.49% as of May 21st. 591 new confirmed cases of novel coronavirus were reported in Delhi in the last 24 hours, taking the number of cases to 12,910. The Delhi government confirmed that 6,267 people have been cured so far and the recovery rate reached 48.54%. In the last 24 hours, 370 patients have recovered and 23 deaths have been reported in the national capital, taking the toll to 231. On the other hand, 14 new areas were added to the list of containment zones in Delhi on Friday, taking the number of such zones to 92 in the national capital. However, till date, 34 areas have been decontained in the national capital. 60 new cases were reported in Assam on Saturday morning, the biggest spike so far. With this, active cases have gone up to 258 in the state. Health Minister Himanta Biswa Sarma said on Twitter that 7 people were found positive on Saturday. 54 patients have recovered so far. Panchayat and Rural Development Minister Nabakumar Dole said the first installment of the PM Garib Kalyan Yojana has been sent to over 8,51,000 beneficiaries. On Saturday, the Chhattisgarh government classified 4 development blocks in the state as red zones and 80 as orange zones. With 40 new cases detected on Friday, Chhattisgarh's COVID-19 tally rose to 172, of which 110 are active cases and 62 patients have recovered from the infection. As many as 21 more border security force personnel tested positive for coronavirus. All are under treatment in designated COVID-19 healthcare hospitals. Till date, 286 personnel have recovered and were discharged from hospitals. There are 120 active cases in the force. The Sikkim government is reopening schools for classes 9th to 12th and colleges from 15th June, but all junior classes will remain suspended till further orders. The Sikkim Education Department has listed guidelines for educational institutions to follow. These include mandatory wearing of masks by teachers and students, social distancing, restrictions on all gatherings, and conducting classes in shifts. Sikkim is the only coronavirus-free state in the country. It is also the first state to announce reopening of schools and colleges.
The Railways has ferried over 35 lakh migrants on board 2,600 Shramik special trains so far.
Railway Board Chairman Vinod Kumar Yadav told the media that 80% train journeys were undertaken by migrant labourers of Uttar Pradesh and Bihar. 13.54 lakh people returned to UP from other states in over 1,018 Shramik special trains. The Railways is also operationalizing 2,600 more Shramik trains in the next 20 days across the country. The initiative will benefit around 36 lakh migrants.
अगले 10 दिनों में जो हमने ट्रेनें शेड्यूल करी हैं वो करीब 2600 ट्रेनें शेड्यूल करी हैं और उसमें जो हमने ये अनुमान लगाया है कि अगले 10 दिनों में 36 लाख पैसेंजर्स को हम ट्रेवल करा पाएंगे और 1 जून से 200 और ट्रेनों को चलाने का निर्णय किया है और जिसके लिए कि हमने बुकिंग ऑलरेडी शुरू कर दी है।
2600 से ज़्यादा श्रमिक ट्रेनें चल चुकी हैं। 35 लाख से ज़्यादा प्रवासी श्रमिक इन ट्रेनों का उपयोग कर चुके हैं। रेलवेज का हम शुक्रिया अदा करते हैं कि उन्होंने 1 जून से 200 रेगुलर ट्रेन्स भी चलाने का बंदोबस्त किया है और अभी तक 14 लाख से ज़्यादा बुकिंग हो चुकी है। इंटरस्टेट बस मूवमेंट द्वारा भी 40 लाख माइग्रेंट वर्कर्स से ज़्यादा यात्रा कर चुके हैं और आज MHA, रेलवे, स्टेट्स और यूटीज मिल करके इस पूरे प्रोसेस को और भी सुगम बनाने के लिए और भी फैसिलिटेट करने के लिए जुटा हुआ है।
Meanwhile, the JNK government said 13,000 migrant labourers in Jammu and Kashmir boarded trains from the Katra railway station for Chhattisgarh and Madhya Pradesh since the 19th of May. A train left at 1 p.m. with 2,206 labourers to Chhattarpur, Madhya Pradesh. Migrant workers from Rajasthan stuck in Anantapuram district of Andhra Pradesh were also sent to their native state in a Shramik special train. The Western Railway said it has operated 863 Shramik special trains from the 2nd to the 22nd of May from its Mumbai division. It said the trains carried 12,72,776 passengers to their destinations. The South Western Railway was operating 12 Shramik special trains on Saturday to carry the migrant labourers, workers, students, tourists and others to other parts of the country. These Shramik special trains will run from Bengaluru to different states like Jharkhand, Bihar, Odisha, Kerala, Manipur and Uttar Pradesh. The railways started running Shramik special trains from the 1st of May to move stranded migrants and others.
National carrier Air India has begun ticket bookings for domestic travel that will resume operations from Monday.
After a 2-month gap, India will reopen 1/3 of its air travel operations from Monday. The government will set limits on fares for 3 months. Many private players like Vistara, Indigo, GoAir, SpiceJet and AirAsia have resumed bookings for domestic travel. Guidelines have been issued for passengers and airports to be followed during flight operations. These include passengers reaching the airport 2 hours before their flight. No entry for passengers not showing green on their Arogya Setu app into the airport. Arogya Setu app will not be mandatory for children below 14 years. Sanitization of baggage before entry into terminal. Cabin crew will be required to be in full protective gear. Compulsory web check-in, only 1 cabin bag and 1 check-in bag allowed. Boarding will be done in batches to maintain social distancing. Seating arrangement of passengers will also be done to maintain social distancing. Passengers will have to wear protective gear, face mask and also carry sanitizer bottles. Airlines shall not provide meals on board. All airport staff to wear PPEs and also carry hand sanitizers. State governments and administrations will ensure public transport and private taxis for passengers and airline crew. Trolleys will not be allowed in the arrival or departure sections except in special cases. Pregnant women and those with health issues advised to avoid air travel in the first phase.
Civil Aviation Minister Hardeep Singh Puri said on Saturday that the government will be able to bring back 50,000 Indian nationals from abroad through special flights in the first 25 days of the Vande Bharat mission. So far, 26,756 Indian citizens have been brought back from different countries across the world.
An Air India flight from Maldivian capital Male carrying 150 Indians arrived in Delhi at 5:30 p.m. The flight brought people domiciled in Delhi, Haryana and Chandigarh.
We will continue with this exercise of evacuation. We have a Navy ship leaving for duty port on 5th of June and we are also planning more evacuation flights to different parts of the country since the Indian community here is very diverse and comes from all parts of the country.
5 Air India flights from Gulf countries brought back 885 Indian nationals to Kochi, Trivandrum, Kannur and Kozhikode on Saturday. Flights carrying 177 Indians each arrived from Muscat to Kochi, Muscat to Trivandrum, Dubai to Trivandrum, Abu Dhabi to Kannur and Dubai to Kozhikode. Apart from this, a flight each from Sydney to Amritsar and Melbourne to Bengaluru will bring home as many as 684 passengers at around 10 p.m. Earlier on Friday, over 3,500 Indians returned home through special planes of Air India and Air India Express. The government started one of the largest initiatives to repatriate nationals back to India on the 7th of May.
The Union Health Ministry has issued a revised advisory for use of anti-malarial drug hydroxychloroquine as a preventive medication for COVID-19. After various studies by ICMR and other bodies found that hydroxychloroquine reduces chances of contracting the deadly disease.
The advisory has recommended the use of HCQ for all asymptomatic healthcare workers involved in containment and treatment of COVID-19 and asymptomatic healthcare workers working in non-COVID hospitals. The drug has also been recommended for frontline staff on surveillance duty in containment zones and paramilitary and police personnel involved in coronavirus infection-related activities. Asymptomatic household contacts of laboratory-confirmed cases are also advised the use of HCQ. The revised advisory, however, cautioned that the intake of the medicine should not instill a sense of false security. It also says that the report of the in vitro testing of HCQ at NIV Pune for antiviral efficacy showed reduction of infectivity and log reduction in viral RNA copy of SARS-CoV-2. The drug has been contraindicated in persons with known case of retinopathy, hypersensitivity to HCQ and cardiac rhythm disorders. It is also not recommended for children under 15 years of age and by pregnant women. The drug has to be given under strict medical supervision with an informed consent. The prophylactic use of HCQ was reviewed by the Joint Monitoring Group under the chairmanship of DGHS and the National Task Force for COVID-19 constituted by ICMR.
The world is gradually opening up in search for normalcy in the novel coronavirus era.
In Madrid, residents jogged and walked outdoors on Saturday, expressing their excitement as Spain went into the next stage of the de-escalation plan. The government has eased restrictions in Madrid and Barcelona from the 25th of May. The relaxations include allowing bars and restaurants to reopen on pavements and terraces and gatherings of up to 10 people. Spain started phasing out lockdowns in other regions earlier this month. During the holy month of Ramadan, a Berlin church is hosting Muslims for prayers who are unable to fit into their mosques because of social distancing guidelines. Germany too started reopening places of worship since the 4th of May with mandatory social distancing. France has also lifted restrictions on religious gatherings. On Saturday, the government allowed religious ceremonies and gatherings immediately. Wearing masks during ceremonies and hand sanitization at the entrance has been made mandatory. Britain is also preparing to lift its ban on international travel as part of economic recovery. However, travellers arriving from overseas will be required to self-isolate for 14 days. Denmark too is set to lift foreign travel ban starting Monday. US President Donald Trump announced that his administration will deem places of worship as essential service and urged state governors to allow reopening of churches and other places of worship over the weekend. Meanwhile, in a major relief to nations worldwide, China's COVID-19 vaccine trial is showing promising results. In a study published in the medical journal The Lancet, China's COVID-19 vaccine phase 1 clinical trial has been found to be safe, well tolerated and induces rapid immune response against SARS-CoV-2 in humans. However, further research is needed to confirm whether the vaccine protects against SARS-CoV-2 infection. More than 5.3 million COVID-19 cases and 3,40,290 deaths have been reported so far worldwide.
2 days after the severe cyclone Amphan hit the West Bengal and Odisha coast, relief efforts are on in both these states on war footing.
Badly hit by the cyclone, the West Bengal government is working 24/7 for immediate restoration of essential infrastructure and services, said the State Home Department. 10 additional teams of NDRF are being sent at the request of the West Bengal government, while 26 teams are already deployed in the cyclone-affected areas of the state. Work is also underway to remove lampposts and fallen trees from the roads. West Bengal Chief Minister Mamata Banerjee said that the government is working to restore electricity as soon as possible, as many affected areas remain without electricity. Power supply has been restored in some areas, but many places remain without electricity. The West Bengal government has also requested the Railway Ministry to not send any Shramik special trains to the state till 26th of May, as officials are busy in relief work. Touring the cyclone-hit areas of South 24 Parganas, Mamata Banerjee also held a review meeting on the restoration efforts. For relief efforts in Odisha, the Home Ministry released 500 crore rupees aid to the state less than 24 hours after Prime Minister Modi's visit. Most of the roads have been cleared and power supply has been restored in many areas. Meanwhile, the European Union has announced an aid of 500,000 euros for people affected by the cyclone in India. UN Secretary General Antonio Guterres has also expressed grief over the loss of lives due to the cyclone.
The Met Department has predicted heat wave conditions in parts of East Rajasthan, Madhya Pradesh, Chhattisgarh, Vidarbha, coastal Andhra Pradesh and Yanam, Rayalaseema, Telangana, North Interior Karnataka, Tamil Nadu and also Puducherry.
The Met Department said this was the first heat wave of the current season covering such a large geographical area. It said the heat wave conditions will prevail till the 25th of May. On Saturday, Delhi recorded the hottest day with temperature crossing 45 degrees Celsius. Kuldeep Srivastava, head of the Regional Forecasting Centre of the IMD, said Delhi NCR will have a heat wave over the weekend due to hot and dry northwesterly winds over northwest India. Rajasthan's Churu and Ganganagar recorded 46.6 degrees Celsius on Saturday. The IMD cautioned that heat wave conditions will prevail over Rajasthan and Madhya Pradesh for the next 5 days. The Weather Department also issued a heat wave warning for Uttar Pradesh for Saturday and Sunday.
Former Uttar Pradesh Secondary Education Minister and former BJP MP Dr. Nepal Singh passed away in Moradabad on Friday.
Prime Minister Narendra Modi, UP Chief Minister Yogi Adityanath, BJP President JP Nadda were among those who condoled his death. In a Twitter message, the Prime Minister said he was anguished by the former MP's demise. He said Dr. Singh would be remembered for his numerous community service efforts and the key role he played in strengthening the BJP in Uttar Pradesh. Born in August 1940, Dr. Singh was the member of Lok Sabha from Rampur in Uttar Pradesh as a BJP candidate. He was elected 5 times as member of the State Legislative Council from Bareilly-Moradabad Division Graduates Constituency.
So that's it from us in this bulletin. Thank you very much for your time. Stay safe, take good care of yourselves and your families. Good night.